He was Ian, he was Pops, he was obviously Dad, he was Levy, he was Lev, Del Boy. He had such a character.
There are many ways they'd like to remember Ian Leverington, just not as a number. Another name added to a terrible tally of those who've died in care with COVID-19.
We couldn't see him at all. I did a letter for Dad, explaining everything, you know, how I felt, what I felt. Oh, here we go.
What did you say in the letter?
Loved him.
It's all right, Hayley.
It's like a pit, a hole in your tummy. And it's just difficult. You know, he was a loving man. He really was.
Ian is one of 7 they mourn here at Philia Lodge.
Got a letter from your granddaughter, Peggy.
These were the last words Peggy Granger would hear from her family, read by her carer Laura.
We're so sorry that we can't be with you as you take your final breaths, but we know that the carers who have done such an amazing job of looking after you the past 3 years will be there with you. And we're all there next to you in spirit.
Peggy died 2 days later.
I'll miss her every day. Being here won't be the same without her. Sorry.
It's all right, Laura. It's difficult.
It is.
It's been a tough few weeks.
It has. But we're just trying to be strong for the residents we've got left.
Across the country, the number of lives taken in care is rapidly rising. The Care Quality Commission says more than 4,000 died with COVID-19 in the last 2 weeks alone in England, taking the total there to more than 5,000. Add to that more than 500 deaths in Scottish care homes, 184 in Wales, 93 in Northern Ireland, and the UK total is now more than 6,000. Today, the Health Secretary promised those numbers will now be published daily as the virus sweeps through the sector.
Do you now recognise that while you've prevented the NHS from becoming overwhelmed, there is now a crisis in the care sector? And given that the number of deaths continues to go up in care homes each day, will it now be your main priority?
We keep a close eye on it, and I'm very glad that we're now able to publish these daily data, which will keep the focus on what's happening in care homes. You know, my principle in this is to be as transparent as possible, because then you find problems as quickly as possible and we can get in and address it.
I just want people to know how serious, you know, this is in care homes.
Families of those lost at Philia Lodge had felt forgotten in the figures. There is now a number to put to all these names.